first and foremost, it's obvious that COVID is particularly affected older adults. It affects every single one of the M's of what matters: medications, mentation, and mobility. And we can understand the effects of COVID on older adults through the 4M framework. We had not anticipated COVID when we came up with that framework, but I think it really helps us understand its effects. But more importantly, I think it's going to help us understand how to respond to it and guide us as we do respond. Those of us who provide care in clinical settings know that overnight, literally overnight, we went from the typical face-to-face contact between clinicians and our patients and their caregivers. Overnight, we went to telemedicine, trying to deal with the video conferencing, which I don't know about other places, but here in New Haven still has a lot to be desired in terms of its technology in 2020. Sad to say, hopefully that will be a positive outcome of COVID. But we weren't prepared to have those kind of encounters. We didn't know how to frame them. We didn't know how to have them. We were all uncomfortable with them. And one of the groups that have been involved with the age-friendly health system stepped into the fray and identified a framework for having these conversations by phone and by video, framed within the 4Ms, beginning with what matters most: tips and scripts for addressing medications, addressing mobility, addressing mentation, all within the framework of how COVID was affecting their life, affecting those 4Ms and the rest of their health care.